Dr. Jacob Roy. He will speak about a most important thing. We are physically fit, we can do on our own, but unfortunately sometimes what happens, we are not ourselves and we don't know what we are doing. That's Alzheimer's, which is a real sin for the aged people. Now we'll give an insight into that. We call upon Dr. Jacob. Please, Dr. Jacob.
Yeah. Professor Sundari, ladies and gentlemen, good evening. I bring greetings to you from Alzheimer's Disease International, which is a World Federation of 79 national Alzheimer's associations. And the topic that I'll be talking today is on the global challenge of dementia, with also reference to the situation in India. And my colleague Meera will speak about the caregiving in dementia. First of all, I would like to thank Dr. Rao for giving me this opportunity and also organizing this wonderful conference. I know how it means to organize a conference on this topic in a country like ours. Dementia, as most of you would know, represents or a term which is used to describe chronic degenerative disease of the brain, which presents with progressive loss of memory and which subsequently leads on to physical and intellectual decline, leading that person to be dependent on their family members for day-to-day life. We know that we live in an aging world where the current number of people who are above 60 from 600 million, which will go on to become 2 billion in 2050. And the number of persons over 80 will increase fivefold from 69 million to 379 million by 2050. This rise in population also will see a large increase in number of persons with dementia. And as you can see from this slide, that the current estimated number of people with dementia globally is 36 million, which is expected to grow to 66 million by 2030 and to 115 million by 2050. But the sad thing is that out of this 36 million, in the developing countries like ours, not more than 10% of the people get diagnosed. And even in the developed economies like North America and Europe, not more than 40% of the people get diagnosed. So the vast majority of people don't get diagnosed. Now, this is not just a medical condition of one person. It affects the caregiver, the family members, the friends, relatives, neighbors, and the society at large. It's a costly disease. It affects the families. It also has got social, economic, and health dimensions. And the interesting thing is that, unlike what most people believe, that dementia is becoming more of a problem in developing countries like India and China. The need for long-term care creates strains on health and social systems and the budgets of governments. And the high cost can push millions of households to below poverty line. Overwhelming numbers and staggering economic burden on the families and nations make a strong case for making dementia a public health priority. Now, this is just to give you an idea of what it costs to take care of people with dementia globally. And it's estimated that the cost of dementia care is over $600 billion per year. And if you are to consider dementia as an economy, it would be somewhere between the gross GDP of Turkey and Indonesia. And it would be the 18th largest economy in the world. And in low-income countries, we spend a lot less as compared to $36,000 per year in high-income countries like United States. And this comprises of informal care, cost of care by the family members, and also the cost of medicines, and also the social costs. Now, in the developed nations, they are looking for options for care for dementia patients at home due to the funding cuts and also reduction in the nursing home beds. Whereas developing countries like ours, we are also looking for facilities like providing daycare, nursing care facilities, residential homes, and also respite care centers to take care of persons with dementia. The ideal situation would be a judicious partnership between families, societies, and governments. We at Alzheimer's Disease International have been working a lot with WHO and United Nations. In 2008, WHO launched the Mental Health Gap Action Program, which included dementia as a priority condition. And in 2011, the high-level meeting of United Nations General Assembly on Prevention and Control of Non-Communicable Diseases adopted a political declaration as mental and neurological disorders, including Alzheimer's, are important cause of morbidity that contribute to global non-communicable disease burden. And 2012, WHO released a world report titled Dementia, a Public Health Priority in association with Alzheimer's Disease International. Showed you in the beginning, and also the impact of dementia on the society and on the families and also on the governments, and a national level approach to dementia, including the role of the health and social care systems, the need for trained workforce, and also caregiving issues, awareness raising, and also advocacy for dementia. WHO report also aims to encourage countries to be prepared for this epidemic, which is called as a silent epidemic of dementia, and to strengthen the national policies in order to meet with the challenge of dementia care. And this needs to improve the social well-being and quality of life of people with dementia and their caregivers. India is the first country from the developing world to have its own country report, and I am very proud to say that the Alzheimer's and Related Disorders Society of India, which is a national association which works for people with dementia, is the first country to have its own country report on dementia, which was released in 2010. And this talks on the prevalence of dementia, impact on the cost, and also the services which are available for people with dementia in India. It is estimated that there are 3.7 million Indians affected by various forms of dementia. When I say dementia, it is not Alzheimer's disease alone. There are nearly 100 conditions which causes dementia, but vast majority of it is it's because of Alzheimer's disease. And this number is expected to double by 2030, and the cost is going to triple in the next 20 years. And families, as you can expect, are the main carers, and they provide the care, and they are desperately looking for help. This report also tells us the possible steps that needs to be taken to address a public health challenge, the importance for early identification, and need for simple, effective intervention strategies, action plans for wider implementation, and also a call for action to the central and the state governments to develop a national and state strategy. And I am pleased to inform you that we have submitted this report to Government of India, both to the Ministry of Health and also the Ministry of Social Justice and Empowerment. And they did take it into consideration, and some plans have been included in the coming 5-year plan. Because of the reduced family income and increased out-of-pocket payment for care, which enhances the economic vulnerability, making the poor poorer, we need to plan for services and also provide infrastructure and capacity building, and also to provide training to healthcare personnel at all levels. Families remain the cornerstone for dementia care, as I've mentioned in the beginning, and this should be so. But we need to take the advantage of the unique family support system that we have in our country when we plan for services for people with dementia. We need to provide support to the carers. We need to use locally available non-specialist volunteers to both detect cases of dementia and also to provide care. As I mentioned earlier, only about 10% of cases get diagnosed. What is required is good quality training, research, and a strong political commitment. This we all know that in our society we have this belief that it is our duty and it's our obligation, as we heard in the morning, to take care of our elders, even in a situation when they are afflicted by diseases like Alzheimer's, or some people take it as our fate, and the family members carry the guilt feeling when they are not able to carry on with this responsibility. There is respect for elders in our society, which we need to take advantage of. There are social barriers which prevent from making early diagnosis. This is a group which is dedicated to do a study on the care arrangements in developing countries. It is called 1066 Dementia Research Group. They have conducted a study in the developing world, in Latin America, India and China. And they have found out that most caregivers were women living with the person with dementia in extended family households. And larger households were associated with lower care strain. And many had to cut back on work to provide care for people with dementia. And they faced with the additional expense of paid carers and health services. Physicians in our setting, especially at the primary care level, many of them don't have much training in making an early diagnosis. This is one reason why most cases are not diagnosed at the early stage. These are the recommendations made in the Dementia India report to make dementia a national health and social care priority, increase funding for dementia research, increase awareness, improve dementia identification and care skills, and guarantee carer support, and also develop community support, develop comprehensive dementia care models, and develop national policies and legislations for people with dementia. So, to conclude, this is the time to act to develop dementia-friendly communities, not just build institutions, and to create a society which is friendly to people with dementia, a knowledgeable society where a person and the average public know about this particular condition, where a person with dementia can live a life of honor and dignity which they truly deserve, which is their right. So I would like to welcome you all to this conference which we will be organizing in New Delhi next year. And lastly, this is a slide showing September as a World Alzheimer's Month with the theme Dementia, a Journey of Caring. Thank you very much.
Thank you very much. And any questions? I think he has finished before his time.
And that gives details of all the services which are available within India, and also the other resources, not necessarily daycare centers. I mean, we have a very well-run center which is run by the Nightingales in Bangalore, but there are several such facilities available within the country. Beg your pardon? Yes, of course there are. Caregivers manuals we have both in English and also in the local languages.
Where are they available?
Oh, we can give you the details so that they can contact us, so that we can send it to them. No. I live very much in India. I live not in America. I live in India. I live in India, in Kerala. Oh, okay. I did not.
But address in India, sir?
We can give you, soon after this meeting, we can give you our card with all the details of the website and also where you need to contact for further information. And tomorrow, the National Chairman of Alzheimer's Society will be making a presentation on caregivers' burden and also caregiving issues. And she will definitely be giving you contact details of this source in India.
Tomorrow?
So, yes, sure.
He will give us?
Yeah, sure.
Okay, sir. Thank you very much.
Any other questions? Just wait. There is a question here coming up. Please wait.
Sir, is there any reported works of the molecule curcumin extracted from the Curcuma longa? Is there any report to have any effect on the Alzheimer's disease of this molecule?
I know of two studies which are being conducted, one in the United States, another one in Singapore, but we have not got a conclusive report. But personally, we are using curcumin, extract of turmeric, on a number of our patients, and we have found excellent results. I mean, not alone, it is with other medication. So with other medication, this seems to be working. The unfortunate thing is that the quantum of the quantity of curcumin that we need to give is quite large, and we can't really give to actual patients. So what we are giving is subclinical dosage. That may be the reason why we are probably not getting so much of a result in the studies which have already taken place. But yes, of course, this is one of the things which is being tried on people with dementia.
Thank you, sir.
And yes, you were saying something about?
Yeah, I just wanted to know whether the dementia condition is hereditary or what are the causes that result in dementia condition?
Now, I can speak as far as Alzheimer's disease is concerned, which is the commonest, and not all Alzheimer's disease are hereditary. There is a small percentage, which may be about 10% of Alzheimer's are familial Alzheimer's, which may run in families. We really don't know the actual cause of Alzheimer's. The only known risk factor is age. So with increasing age, a person has got more chance of developing dementia. So your chance of developing dementia after 80 is 1 in 5. After 65 is 1 in 20.
Hello.
Okay, I think,
Last question.
yeah, will be last.
Yeah, I am Ramdas speaking here. I wanted to know that there is a general impression people living in the rural areas have much less of dementia than the people living in cities and urban areas. Is it true?
I'm not aware of it. I don't think so. I don't think so. In fact, we did a study in a rural village in Kerala, which actually showed slightly higher percentage, prevalence of dementia. So I don't think it is statistically proven that the rural areas have less Alzheimer's as compared.
They may not seek a medical aid from the rurals. They may be just left in the houses. That's why we don't see that. In urban, at least, they will be seeking some medical aid. That's why the prevalence probably it looks maybe more. Thank you very much, Dr. Jacob, again.
Madam,
I think we will wind up this session.
Madam, may I ask one more last question?
Please, we are encroaching onto the others' time, I feel. Yeah. Probably you can ask him at the tea time, and then I'll thank all the speakers for the wonderful insight into their subjects and lot of knowledge we have got from them. And I thank the organizers, Dr. V.P.Rao and his team, for giving me this opportunity to chair this session. Thank you.
Thank you, Dr. Sundari. We'd also like to call Dr. Jacob Roy back on stage, please. And to present him with a token of our appreciation for sharing his time with us this evening. Thank you so much.